She takes care of it.
I'm going to use that excuse more.
I'm not sure. What
Sorry if I walk away. I made soup. My timing was bad, so I'm waiting to bring my soup to a boil before I have to simmer it. So I may have to walk into the kitchen. I'm sorry.
Okay. We understand your priorities are important.
Well, I got enough soup for everybody, and there's only 2 of us here. So
You deliver?
no, you'd have to have porch pickup and come get it.
Oh.
We'll put it on the table outside the front door.
What kind of
kind is it?
Chicken noodle soup.
Oh, that's good.
Oh,
I diced up the onions and the celery and the carrots.
Homemade.
I even put some corn in it this time, and then we have noodles from a Amish store back in Michigan when I went back for those funerals. So, yeah, I love soup. I like 2 or 3 times a week. I go to Oak Creek Diner and get their chicken noodle soup. It's pretty bad, I guess. It's great soup. It's just bad. I go there 2 or 3 times a week.
Been going out front to Charcoal Grills. They got pretty good chicken noodle soup, but it's just like so full of dumplings. It's filling, you know.
Oh, less broth is good. More noodles, less broth. I love it.
Yeah, they jam it full. You get like a little cup of soup and noodles.
Waiting on Jose. He was having trouble finding the link, so I was trying to get it to be resent to him.
Yes,
Okay.
and I didn't have it, but it obviously got resent to me. But
Yeah.
the only link I had was for the council meeting, so I don't know. What happened.
Yeah,
I don't
saw
know
you
what happened.
earlier today too, so that made it handy. Thank you.
Yeah. Okay. IT is checking. Just give us 1 minute here. Oh. Should be outside enjoying this weather.
That
I
was
went for a walk.
It's nice.
I did. I got 17 bags of leaves to take to the recycling yard tomorrow.
Wow. Sounds like you're going to be sore.
That's a good Oak Creek yard.
Yeah, well, it's got these trees. I mean, most of them are doing well, but we got this big old maple tree that I think it's maple. I don't know, but it's probably been here since the day the house was built, and it just doesn't want to give up its leaves until like Christmas. So it won't be the last. I'm trying to stay on top of it this year because when I waited until it was too late, it was pretty brutal. And I had to get smaller bags because the 55-gallon ones were getting too heavy for me to lift. That's pretty sad. Huh?
Right.
But yeah, the weather's nice, beautiful.
I know. Well, hold on.
Let's see.
Okay, well, they just resent the link, so hopefully Jose will join us, but we can probably go ahead and get started. So let's call the meeting to order at 4:03 p.m.
I'm assuming we have a quorum.
Yes, we have a quorum.
Okay.
Well, that's a good point. 1, 2, yeah, we have a quorum, 5.
All right.
And I didn't hear from Dr. D'Amico, so I guess we'll see, but we can go ahead and do roll call. I'm Darcy DuBois.
Steve Kurkowski.
Gary Hens.
I'm Rick Bearable. Oh, there we go.
Denise Decker.
Dale Pittman.
Right. And then we can move on to approval of the minutes from the September 3rd meeting. Did you all get the email that I sent out with the materials?
Yes.
Okay, great.
Mhm.
Yes.
So there's Dr.
Like
I
D'Amico.
looked over the minutes. They look good.
Okay.
So I'll move to approve.
Dr. D'Amico's here.
Hi, thanks for joining us. We just got started. All right, Rick, motion to approve the minutes. Do we have a second?
A second.
Okay. All in favor?
Aye.
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 Okay. All right, moving on. Get my papers in order here. So I'll go through some general updates and then I'll talk specifically about COVID at the end. Not a lot of other updates as we're still spending the vast majority of our time on COVID response. There's Jose. I got us started. We're just doing updates. You can take over after this.
So sorry I'm late.
No worries.
Thank you.
So good news, we're back to being fully staffed. We were able to fill our part-time public health nurse position as well as our front desk health clerk position. So they both started within the past couple of weeks and things are going really well. We still also have our 10 additional staff here that are helping us with COVID response. I'm not sure exactly how long they'll be here yet, but we are really grateful to have them given the current workload that we've got. Just the other major update is that we were able to collaborate with the fire department this year to provide employee flu shots as well as flu shots for employee family members. So we did that. I believe we had 3 clinics in October here and vaccinated nearly 150 people with those flu shots. So that went really well. And we were grateful to the fire department because they helped us with some staffing, which made it a little bit less of a burden, just given the busy time that we have right now. Data, you can see, obviously we're spending all of our time on communicable disease or COVID and flu shots right now. So haven't been doing a lot of other services yet. Moving on, I did send out the draft 2021 Health Department budget, which is actually exactly the same as the 2020 budget. Obviously this year we haven't been able to do many of our other programs or goals and things, so didn't change any of that funding around at all from 2020. And I believe that goes before council at the next meeting, November 17th, maybe, in a couple of weeks for final approval. I did also include a draft or a list of our expected grant funding for 2021, which also looks very similar to our 2020 grant funding. The one change from 2020 to 2021 is the amount of COVID grant funding that we have. So this year we had a little over $400,000 of health department specific COVID grant funding to help with staffing as well as providing testing services to the community. Right now, the grant funding that we are aware of for both 2021 and 2022, I had a typo on that funding end date for that ELC COVID funding. It actually goes through October of 2022. So we've got just over $346,000 for that almost 2-year period. So significantly less. And we are currently working to figure out what our staffing plan will look like as we go into next year. And still hoping that there may be some additional funding coming from the state or federal government if we need to maintain the current level of COVID response that we have right now. If that changed, then we wouldn't need as many staff. So, but we have not received any word that the expectations will be changing or when they will be changing yet. Any questions about any of that before I jump into the COVID information?
I do.
Sure.
I do. Darcy, some of the funding that you get from grants and stuff, and is that going to be impacted because you're not doing those programs? I mean, you guys, what I'm trying to say is you have to do programs and show some results to get grant funding maybe for the next time. And if you're not doing those programs this year, how's that going to affect grant funding in the future because there's no results to show?
Yep, that's a good question. So fortunately, some of the grant funding that we had that comes through the state was able to be reallocated for COVID response this year. So the state had the ability to do that with the funding that is written into the state budget. So that helped us in that those, those goals and objectives were put on the back burner and they were aware that we wouldn't be able to reach those this year. For other programs like our reproductive health program, which we were just working on getting off the ground, they actually just pushed that funding back a year. So 2020 was expected to be the last year of funding, but now we'll have 2021, we'll have the 2020 funding in 2021, and we'll be able to work on our goals and objectives for that year. So at this point, we haven't, none of our grant funding has suffered, I guess, or been changed as a result of COVID. All of the funders have been pretty understanding about the expectations that are on us as a result of the pandemic.
Okay. And I know that you're not doing a lot of, well, you're doing a lot of work, but you're not doing some of the stuff that you did prior to COVID. And I'm gonna be asking the city administrator to just kind of off topic a little bit to remove that black rope that's there because people are using their restroom, and move that sign that says you're not taking walk-ins to the door of the health department, and then reopen the east entrance to City Hall. I mean, people are going out of it, might as well let them come in. But one of the little things that you're not doing are the Sharps containers. And is there any possibility that you could find time? I think if this goes on and on and on, you're gonna have to find time to at least have people have the ability to come in and do these little things. Like, for example, my Sharps container is not quite yet at the full line, but I'm sure there was other residents who might be in a worse situation than me. It's not filling up as quickly because I changed from Bidurian to Ozempic, and so the needles are a lot smaller. So have you thought about reopening on a very, very limited basis so that some city services can be provided other than just the COVID stuff now that you're fully staffed?
Yep, it's a good question. We had been planning for that and expecting to hopefully reopen at least on a limited term, towards the end of October. And then we got hit with this latest surge, which just set us back a little bit because all hands had to be on deck for the number of positive cases coming in. But we are still working on making a plan for that. We are distributing new Sharps containers currently, so anyone can get that at the main City Hall front desk. We haven't been taking the used ones. Obviously with COVID, we have to, figure out a plan for doing that safely if we're taking materials into the health department. So, but we are thinking about that, but we have made sure that the containers are available if anyone needs a new container.
Okay. I'm done with off COVID comments. I'll wait for you. I'll wait for the COVID thing then. Okay, thanks.
No problem. Okay, so I'm going to share my screen just so I have a couple of graphs to share. Can you see the graphs?
Yes.
Okay, great. So as of today here in Oak Creek, we have 1,702 individuals who have tested positive for COVID. So that's about nearing 5% of the Oak Creek population. I have a graph here that's showing the number of positive tests by week, and you can see that the number of positive tests in the past couple of weeks has been increasing quite quickly. We're just finishing up the next week, and I know that with this first 6 days of this current week, we had over 240 individuals test positive. So this week will be, again, our highest week yet. 25% of the individuals who've tested positive throughout the whole pandemic have tested positive in the past 2 weeks here in Oak Creek. So just extremely busy compared to where we've been, even when we were very busy back in July and August. Currently, we're averaging about 35 new cases per day. This is just looking at it, kind of a 7-day average of our daily cases. You can see that again, the average number of daily cases has grown exponentially since late October. We've had 10,336 individuals test negative for COVID. This next graph just shows the total number of individuals who are being tested every week. We can see that testing has gone up. This week, I believe we'll see another increase. We're getting just many, many results every day. We just received today from the epidemiologist at the medical college a new burden level. So burden level, again, is the number of individuals who've tested positive over the past 14 days, calculated as a rate per 100,000 residents, which allows us to compare that data to other communities. Again, similar story, you can see that our burden level has continued to increase quite exponentially. We're at just over 1,074 per cases per 100,000 individuals here in Oak Creek currently. And then finally, this is the percent of positive tests. So right now, this past 2-week period, we've seen 18.6% of individuals who are being tested are coming back as positive, which again is quite high compared to earlier in the pandemic when we were seeing lower percentages. So even though we're seeing a lot more people being tested, many of them are testing positive, which again tells us what we already know, that there's just right now a lot of disease spreading in our community, as well as across the state and the country, as you know. We've had 26 individuals who have died as a result of COVID here in Oak Creek. We've had just over 1,300 individuals, of the individuals who've tested positive, who have finished their isolation period and been released. And we are continuing to share data updates 3 times a week, as we have been for several months at this point. Some other information, we are hearing from the hospitals that their capacity is starting to be stretched. Certainly in other parts of the state, you've heard news stories about hospitals being at capacity. I don't believe that there are any in this area that are at capacity yet, but they are certainly filling up their beds. I think today's data show that about 20% of hospital patients are COVID patients right now currently. They did open the alternate care facility. So if you remember earlier in the pandemic, they outfitted one of the buildings at State Fair Park as an alternate care facility in case hospital capacity was exceeded. They opened that a few weeks ago and have been serving patients. And what we're hearing from local hospitals is that they are likely to start diverting more patients to that facility so that they can continue to have space in the hospital for those who really need to be in the hospital at this point. Also hearing from hospitals that in addition to the space issue, they're starting to run into staffing issues. So just having more staff, just like the rest of us who are being exposed or testing positive to COVID. And that is also challenging their ability to care for the number of patients that are coming into the facility. So we have, as a result of the increasing cases, had to make some changes to the practices here at the health department. So due to the large number of positive cases, we are no longer able to notify any of the contacts to people who've tested positive. So previously, we would call someone who tested positive and we would get a list of those people who had been exposed, and then we would call those contacts and explain how to quarantine and answer any questions. But right now, all of our staff have to focus on calling the large number of positive cases that are coming in. So we're providing education to individuals who are testing positive about how to notify their own contacts. So we've moved into that. And we have also started to prioritize our positive cases. So we're not able to call all of the positive cases right away when they come in. So we're focusing on older adults, as we know that they tend to be higher risk, and we want to make sure we're answering questions and providing information to them, as well as individuals 18 and under, to make sure that we are identifying anyone who might be in a school or a daycare setting and therefore possibly be exposing others if they're not aware of their positive test. At this point, we are still able to call everyone who has tested positive, but we're doing a shortened interview form. We're not collecting as much data as we had been previously, just given the time constraints that we have. Our goal will be to return to a kind of our typical contact tracing activities as the cases decrease and we have the staffing to do so again. Other updates, we were able to open a South Shore COVID testing site. So we are collaborating with Cudahy and South Milwaukee St. Francis health departments to open the testing site in South Milwaukee. So it's on Rawson Avenue in one of the old buildings on the old Bucyrus campus. It opened just about 2 weeks ago tomorrow, I believe. It's open Tuesdays, Wednesdays, Fridays, and Saturdays, and it's being staffed by a combination of National Guard as well as local staff that we've hired using the grant funding that we have. They have been extremely busy. We were allocated, I believe, 450 test kits per day initially, but that's been increased to 800 as we've seen testing anywhere, 700 and above on those days that were open. So lots of demand. I think there was a need for that testing. At this point, it will be open through December 9th. What we've been told is after that date, the National Guard staff will no longer be available. And the funding that we have ends at the end of the year. So unless something changes with the funding or the National Guard staffing availability, we won't be able to keep it open past that date. But we are working still with healthcare providers and potentially other partners, pharmacies or others, to make sure that testing continues to remain available into the new year.
Hey,
I think that's all the updates I had.
Can I ask, I'm
Yep.
so sorry to interrupt you, but
No, go ahead.
as far as this testing in South Milwaukee, what hours are they open? And also, is it for anyone that comes regardless of being symptomatic? Do you have to make an appointment? Is it a drive-through? What is it?
Question. Yep. So it's open Tuesdays, Wednesdays, and Fridays from 11 until 7, and Saturdays from 10 until 2. I will send out a flyer after this. I intended to do that, and I think I probably forgot to send it to this group, but I will send the testing flyer. It is drive-through, first come, first serve, and they're able to test anyone ages 5 and above. So it's very similar to the testing that was going on at UMOS and the testing that's currently going on at Miller Park. It's accessible to anyone.
Okay. So you don't have to be symptomatic or anything.
You do not, no.
Okay.
And did you say what type of testing is being used?
Yeah, it's a PCR test.
Okay.
Yep, a lab-based PCR test. And we're seeing right now results are coming back in about 2 days. So even though we're seeing a lot of testing, the labs are really doing a great job keeping up with that volume and still getting those results back fairly quickly so that people are notified and starting their isolation.
Darcy, I assume that when you go in for testing, say I'm an Oak Creek resident and I go to Miller Park, there's got to be another step in this notification process where the testing folks at Miller Park notify the Oak Creek health department, and then you would call me. Is that how that works?
Yep. So the labs, after the specimen is sent to the lab then uploads all of their test results into the communicable disease database, and those get pushed out to the various health departments.
Okay.
And then the health departments make that phone call as quickly as we can. However, they have started, if you get tested at a healthcare provider, that healthcare provider will call you with your results. If you get tested at the community site, the National Guard is now calling individuals with their results just to make sure that they get the results as quickly as possible. And then we would follow up as a health department with more specific questions and information about isolation and contacts and things.
Okay.
Any other questions?
Are you done with COVID, or you have more? Because a couple comments.
Oh, I'm done with my updates.
Oh, can we make comments now on COVID?
Sure.
Okay. For the sake of everybody on the Board of Health, Darcy did come to the council meeting, well, via Zoom, Tuesday night, and mentioned that other suburban health departments were considering going to phase B. And we're currently in phase C. And just to make a long story short, I would think that if it came to a vote, and Darcy could correct me, I think if it came to a vote, it would have been 5 against with 1 for moving to phase B. We wanted to stay at phase C, primarily because, and my comments were, government's going to tell people what to do. People are going to fight back then and do whatever they want to do, irregardless of what the government is telling them to do. So that the public education that the health department is using and everybody else who's trying to educate folks, that to us, those of us on the council, think that is the problem with the folks that aren't paying attention to what we're trying to do. I'm trying to say, the example I used Tuesday night was I went into a local bar for a Friday fish fry. Sorry, Darcy, this is old news to you. And I walk in there and purely they're allowed to do this, but there's 3 guys sitting at the bar, yucking it up, drinking beer, sitting right next to each other. Now, I know that's allowed, and it would even be allowed if we went to phase B. So it's, pardon my frankness, but it's stupid people who aren't paying attention to the issues. I would never be sitting at a bar with 2 other guys that aren't in my household drinking a beer. And I think everybody agrees with that. But what we don't want to do is have this government mandate of what you can and can't do, and then have people who are going to say, well, screw it, I'm going to do it anyways. They're still going to have parties. They're still, and it becomes a more, that's the word I'm looking for, a defiant type of attitude versus a compliant type of attitude. And I don't know if that makes sense, but I asked about the complaints that people call in, and Dale is apparently the one that calls and talks to these people. And as I was thinking between the meeting Tuesday night and today is, well, if Dale is going to get repeated complaints or repetitive complaints on the same business, then I think at some point something needs to be done with that business. And I don't, for example, if there are a group of people at a bar and they are violating whatever recommendations that we give them, and Dale has continually asked them to please comply because you potentially are a super spreader site and you're just going to make matters worse, then I wouldn't be opposed to being the chairman of the license committee to say, well, maybe we ought to suspend your liquor license because you're being too stupid to help the community. You know, because if you give them a fine, they'll just pay it. That's irrelevant. They'll just pay the money. So I'm not. That's my concern. And that was the council's opinion about staying at phase C, and that was my personal opinion about. We just got a bunch of stupid people out there who just aren't playing nice in the sandbox, and now we got all these. We got this surge, and it doesn't matter what the government's going to do. People are still going to do what they want to do, and they're still going to go to bars, and they're still going to have people over, and they're still going to do this and do that. No matter what phase we're in, even if you lock it down, we're still going to go out and do stuff. So I think public education in a real serious sort of way might go a lot further than government mandates. And that's my opinion. I will accept anybody else's differing opinion, especially the good doctor who's out there on the front line. So, and Jose. So I think that's all I got. I have one other comment about the burden thing, but I wanted to shut up and let you chime back at me if you want.
Darcy, I do have a question. Can you go over the different phases and what they mean? Like ABC or?
Sure. And if I can find the document real quick, but I'll start talking while I'm looking for it. So the phases are just essentially different. They're all recommendations, and they're different capacity or gathering number recommendations based on data and what we're seeing in the community. Let's see. So in phase B, I believe the capacity recommendation is 75% for most businesses. I'd have to pull it up and see that for sure. And that in phase B, for the most part, it was a recommendation of 50%. Thanks. IT is helping me out here. Thanks, Kevin.
And while Darcy's doing that, I do want to thank Darcy for bringing it to the council's attention about what she'd like to do or what her recommendations were, because I know it's a sore spot with council, not just Darcy, but other health departments just flat out doing whatever they want to do without input from their elected officials. And we're the ones that take the heat when things don't go right. So just to throw that in there.
Okay, I believe I just shared the table that IT helped me find. So this just shows basically different, can you see it?
Yes.
Okay, great. Right, so it's just recommendations on capacity limits. So in phase C, like I said, most of the facilities would have a recommendation of about 75% of their capacity. If we moved back to phase B, the recommendation would be 50% of capacity, obviously to allow for more space and more distancing, and just fewer people in one setting decreases the risk of disease spread. So those are the different phases.
Thank you.
Any other questions?
I didn't intend to open up a can of worms, but I know that was going to come up, Darcy, either maybe today or in the future. So I just wanted to, for transparency, let everybody on the Board of Health know what was going on. For what it's worth.
Well, for what I see by us, it's very few people come in without a mask. You might get 1 out of 200 that'll come in without a mask. And then usually if you ask them, they put it on. Some people come up with some excuse, but it seems like the biggest part of the population is kind of following the rules anyway.
Gary, I agree with you. I mean, I go to Meijer and I go shopping. We go to restaurants. We sit down. We take our mask off when we're allowed to. But Julie just torqued me a little bit when I walked into this bar. You know, these guys they're doing what they're allowed to do. But come on, guys, you know, can't you sit a little further apart than shoulder to shoulder, yucking it up and drinking a beer? You know, it's frustrating. And I'm afraid that society as a whole is starting to be penalized for this certain age group that seems to think they're immune to any issues. Personal opinions, I know.
I mean, I just see, you hear different people talking, and for some reason, people think once they have it, they don't have to worry about spreading it because they're done with it. And you hear all kinds of stories. I mean, I see a lot of people every day, so you hear different stuff. I
Lots
think
of
for the most part,
misconceptions.
most people use pretty much common sense anyway.
Yep, I think you're right. There are a lot of misconceptions, and we do continue to share kind of educational information on social media and our website, you know, as we get questions. Especially we get a lot of questions still from the community. So if we're noticing a trend in questions, or if we're noticing things when we're talking to clients, we work with our communications person to develop different graphics and messaging, and we will definitely continue to do that as we continue to move through the pandemic.
Dale, are you getting a lot of complaints on that form that's on the website? And do you have any repeat offenders?
Yeah, well, I've got, since August 1st, I've got 95 complaints, and one place has probably got about at least 20 to 25% of that 95. I haven't got any in the last week from them, but so that's good. But I don't think they've changed. They absolutely refuse to wear masks.
Would you be willing to send me that information as chairman of the license committee if it's a liquor license establishment?
Well, it's a retail license. It's the
okay.
employee. It's the owner and the employees that won't
Okay.
wear the mask. And it's like, all I'm doing now is I just send them a text message when I get a complaint, just to let them know I got a complaint, and because he's made it pretty clear that he's not going to wear masks. So,
and he would be one of those businesses that even if we went to phase B would still have the same opinion.
Yeah, and it's based. Yeah, and his customers thank him for they're not enforcing the mask usage in too. But then you get the one that walks in there that wants to wear a mask, and he sees everybody else not wearing a mask, and then that's where the complaint comes in. So,
okay.
All
right.
So maybe those people just have to stay out of there, and the ones that don't want to wear masks just go there. I don't know. I don't know how a fine probably, because he said his business actually is doing better since the COVID than it did before. So.
Yeah, I know a pizza place that's primarily takeout that's done wonderful business because it's just been takeout. So, okay. I can move on with another one, Darcy. I'm not trying to open a can of worms, but these are things that are coming to me as an alderman. And the next one is 99% out of my arena, but it affects kind of the Board of Health and you, Darcy, because you're the city health officer. And that's the burden rate that is used by the school board to keep the schools closed. And there's a lot of public opinion that is the burden rate ought to be thrown out, and the school district ought to use some sort of other formula, because they look at other school districts that are not only open, but they're able to manage issues that are within their school district, and they don't look at the overall problem. In other words, they're telling me the problem in Oak Creek isn't necessarily a school district problem. It's a problem in Oak Creek, but the school district doesn't seem willing to go past that burden rate. So, you know, I tell the residents that, look, I'm not on a school board, but I will bring it up at the Board of Health meeting to let you know that part of the issue, the burden rate, which, Darcy, you are probably, we're not responsible, but I mean, you are, because of I'm not trying to be antagonistic, but I'm just saying you're intimately involved with this school board issue. So question I have is, can you see a way to get away from that burden rate to allow the school district to do something different? Or is that pretty much going to be it? Because with the current level, these kids aren't going to be back in school until September of next year. I'll leave it at that, because I will have fulfilled my constituents' comments.
Sure. So the recommendations for school metrics and which learning model they would use at various data points was developed jointly by all of the Milwaukee County health officers, so from each of the health departments. And we each shared that recommendation with our respective school districts, and then each school board made their own decision about if they would adopt those metrics or if they would decide on a different type of metric or plan for which learning model they would use. So here in Oak Creek, the school district did decide to adopt the recommendations that were made, which means they have decided to be in a virtual learning model right now based on the data. I don't see that the recommendations from the health officers changing. They were based on DHS information, as well as the Harvard Population Health Institute model for assessing risk for different activities based on community data. I think it's very difficult to remove a school district from the community data, just given the fact that the students and the teachers and the staff are all, most of them are living in that community or a surrounding community, when we're all in the same boat here. And, therefore at risk, if there's more disease in the community, they are more likely to be exposed and then bring disease into the school. So it's hard to separate those things out. But that being said, the school board can certainly change their plan or their metrics at any point. They don't need approval from me to do so, or the health department.
I know you're kind of stuck in the middle, because you're doing your job and they're the ones that adopted this policy. And then, I get calls and complaints and stuff like that. And I'm sorry, I can't help you. So I've done my job. All right. Thanks, Darcy. I think I'm done.
Any other questions on COVID, or questions or comments on COVID from the board? Otherwise, I know we have a guest who would like to speak for her 3 minutes. Okay, why don't we go ahead and open up the line?
Just 1 second.
Sure.
All right, Rosemarie, you should be able to speak. You have to unmute yourself, and then we'll just need your name and address too for the record.
Rosemarie Adamson, 3920 East Ryan Road, Oak Creek, Wisconsin.
Thank you. And then you are free to start.
All right. I submitted some questions, and I don't know how that's handled. Does Jose ask them?
I can see them. I can go ahead and ask them.
Would you?
The first question, are there any projections on COVID? I've heard that our deaths are going to triple in mid-January as related to this ongoing surge. I don't know if I've heard any projections about deaths, though I think what we know is that deaths tend to follow a surge in cases. So right now we're starting to see an increase in hospitalizations. We have already seen an increase in deaths across the state. And so it seems likely that we will continue to see an increase in deaths based on this surge.
And the next question?
Do we know how many Oak Creek residents are currently in the ICU? I do not know that. The only way that we know if a patient is hospitalized is if we tell that, or if they tell us when we make our phone call after someone tests positive. If they happen to go into the hospital after we talk, we wouldn't have a record of that, nor do we know when they're discharged. So I don't have a current hospitalization number.
Are you guys going to continue to do the contact tracing?
We will continue to notify individuals who test positive and do contact tracing as our staffing allows. So that is still the expectation from the state that we are doing contact tracing. As I talked about earlier, we have had to adopt the way that we're doing that just based on the large number of cases, but we will continue to do that as long as that is the direction from the state.
Have you given any more consideration to Jose's suggestion that we use Weaver?
I think some health departments have tried to activate Weaver. I think the challenge is that most people so Weaver is a public health volunteer base. Most people who are signed up as volunteers in Weaver are currently working. And so they wouldn't be able to assist in a large capacity with the day-to-day needs that we have.
Is there any way that residents like myself that are retired can help you?
Just given the nature of the work that everyone who is doing the contact tracing does need to be a paid employee because we have policies and HIPAA and things like that. So unfortunately, we're not able to use volunteers for that.
All right. And is there another question? Oh, yes, the holidays. Darcy, can we do something for the residents, especially for the children, so that we can keep Christmas active and safe?
So I'm not the city events person, but I do believe the Celebrations Commission is working on planning an outdoor lights, Christmas tree light up event like they have done in the past. And I've been working with them, providing some suggestions and feedback to try to make that as safe as possible. So I think, as with everything, we're trying to balance safety and risk with, again, making sure that there are still the traditions and events that people have come to expect.
I know
Darcy, I can help you. Rosemary, if you hold on a second. Darcy, I can kind of help you with that.
Thanks.
With regards to the Christmas tree or holiday tree lighting, Rosemary, the plan is still to have it because it's an outside event.
Good.
So like Darcy said, they're kind of working with some metrics to try and make sure that it's a safe event, much like how we had the farmers markets and the food truck nights where face masks and social distancing was expected, but not always the case, but they tried. There had been an indoor portion of that event in years past. That will not occur. There will be no indoor event. It will all be outdoors.
Good. What about the sledding hills and that, Steve?
I would think Darcy, correct me if I'm wrong, but I would think anything sledding would be just like playgrounds. I mean, the kids go with their sleds, they go up there and they slide down. I mean, and there's not much you can do. It's outdoor. It's their own sleds, kind of like the playgrounds. Rosemary, I'll tell you, I umpired over 100 baseball games this year, and not one incident was attributable to any baseball game that I umpired, any tournament that I worked, because people were generally trying to behave as best as they could in an outdoor environment with social distancing and equipment and cleansing. And I would think letting kids go sledding would be no different.
I agree with you, and I would like to encourage the parents and the parents that have relatives that do not live in their household. They could get together with the kids, and it would be pretty safe, I think. Would we need to wear masks?
Well, if they're outdoors,
it'd be all right.
Well, what Darcy, isn't the current mask mandate is that you don't need them outdoors unless you can't social distance, correct? I mean, if you're in an
the
outdoor
mask
event,
order, Yeah, the mask order only requires them indoors. I think my recommendation from a public health standpoint would be to wear a mask anytime you're with people who are not in your household. So if you're going sledding with a group of friends or whatever, I would recommend wearing a mask just to
And
be
Darcy,
safe.
one last question is, can you tell from our contact tracing if our cases are now arising out of the home where grandma and grandpa are letting the grandchildren in? I mean, we're all getting pretty COVID tired.
Yeah, we see a lot of spread from, small gatherings. A lot of those are family gatherings. And I think, we tend to trust our families. And so we hear from people that they don't wear masks, they don't distance from their, immediate family members. And so that is a high risk for COVID disease spread right now.
Could we do a mailing?
We could, I think we're always thinking of different educational ways. I don't know if that's a surprise to people, but we are, sharing data on our website and social media and, could consider other ways. I don't know if that's a cost effective or the best way to do it, but
I think it would be the best way to do it because I think we'd reach people that aren't using our websites. If we did a mass mailing and suggested, the recreational and the safe contacts, things like that, your recommendation, I would agree. We, kids on a toboggan from non-household should wear a mask. That's all I have to say. Thank you.
We will be sending out the current and the Acorn have both had educational information about COVID, and that does go to all the households in Oak Creek. I just remembered that. So that is something that we are doing, and we will, I believe the one coming out now has some holiday specific and gathering recommendations.
Hey, Darcy, I want you to mark the tape, so to speak, because I agree with Rosemarie. That maybe a 5x7 postcard that kind of talks about fall and winter events that might be happening or winter things that might occur, like the sledding and other things like that. Maybe that just might be, I remember I complained earlier about public education and trying to educate folks, and maybe a 5x7 postcard that specifically talks about the holiday tree lighting event and the sledding and ice skating and kids playing in the snow and stuff like that. That just might be a nice little tool to try and let the folks know who don't get the current and don't get the Acorn. Well, they all get it, whether or not they read it or not, it's another thing. And so I said, mark the tape. I agree with Rosemarie.
Okay, we're gonna move on.
Yes, let's move on. Can I make just one quick comment? If you're going to send out a little card, you might want to send a little card that says, hey, everybody, you want to read your Acorn and your current because we've got a lot of good information about COVID and outdoor activities this winter. Therefore, you don't fill up your card. So then they'll look at it and say, that's too much to read, and then they throw it out. So if you're going to do a card, maybe it's just a card saying, please, look in your current issue or your next issue of Acorn or et cetera for more information. But yeah, could we go on? I'm not sure where we are on the agenda, but I think
environmental
we're at the environmental health update. So Mr. Dale, please.
Yeah, okay. Yeah, just to let you know, all the licenses did get renewed from this last year. So everybody did renew. Only one, which went out of business, Agave Blue, but that was expected, whether COVID or not. But surprisingly, I've licensed 7 new places since, and I've got a couple more that are waiting to get the license probably by the end of the year. So, so surprisingly, we're getting new stuff too. So, ATCP 75, which is the retail food code, and the food code that was all updated. So that went in effect a little over a week ago. So basically the fee structures will change a little bit where we're licensing now the retail and the restaurant. It'll convert from one structure to another, but for the most part, fees should not change at all. If everything kind of goes parallel from one to the other. So, but we'll be able to look at that probably more like in January, February, when I'll be able to look at that. So Yeah, otherwise I've been trying to stay safe out there. I had one exposure, so at a school, so but otherwise I've been, yeah, I had a little vacation time at home from that. So other than that, yeah, we talked about COVID and the mask complaints. So essentially, we've been averaging about one complaint a day since this started in August 1st. So, but and actually lately it's been kind of slower. So some of those complaints were more previously, but it's starting to slow down a little bit. About all I have. Anybody got any questions at all, or?
I have a question. Have you had any impact with Amazon moving in? Anything that's
Yeah, actually, there's a micro market going in there. So that's one of the licenses that I'm waiting to get finalized. I got the application and the payment, and so once they're up and running, then I'll get there and do my inspection stuff to finish the licensing off. So.
okay? Any other questions, anybody for Dale?
Nope.
If we can move on to, I presume Darcy, you did a roll call, correct?
We did. Yep.
You did, thank you. I do apologize for being late. I was having trouble getting online. Excuse me, any old business other than what we've already talked about?
Nope.
No. Any new business? We've got election of officers, chairperson and secretary. And I know we always move that Darcy be secretary. So I'm sorry, excuse me, let me back up. I'd like to entertain nominations for chairperson and secretary, please. Everyone's muted.
Can I nominate Jose? Are you okay being the chair again?
Sure, that's fine. As long
Okay.
as I get to the meetings on time. Yes, I apologize again for that.
And Darcy, are you okay taking notes? Do you want someone else to?
I'm okay to continue doing that unless someone else is very interested.
I don't see anybody
no
be
one's
You know, hands
so-
go up on that one.
I don't
So
see
I
why
would
not.
nominate then Darcy as secretary and Jose as the chair.
I'll second
Anybody
it.
second? Okay. Any discussion? Anything? Okay, all in favor?
Aye.
Aye.
Opposed? Abstentions? Okay, super. Thank you, everybody.
Well, thank you and Darcy for
Yeah, thank you,
holding those
Darcy, for
roles.
those great minutes. If it were me, it'd be a novel. So it's good. I'm not doing it. 2021 meeting dates. As you can see on the agenda, if you don't have it in front of you, it is the odd months, it looks like, of the year, usually the first week, the first Thursday of the odd months of the year. So that's January, March, May, July, September, November. The first Thursday of the month each month at 4 o'clock. And Darcy, I presume we're going to continue with the Zoom until otherwise told.
Till further notice at this point. Yep.
Okay. Right. Are we all okay with that? Put it on your calendars.
Yep.
Okay.
Yes, I'd like to comment, the very next line, the incorrect date for January's meeting was listed.
Oops.
Oh,
Sorry about that. That was my fault. Let me just. January 7th. Oh, I see what you're saying. Yes, I put the 5th. Got it. It will be January 7th. And I will send out
thank
invites
you.
to all of the meetings as well.
Great. Can I ask a favor though? When the IT people send us the invite for the Zoom meeting, can they send it like maybe a day or two before, as opposed to 3 weeks before? Because I have a lot of trouble finding it.
Yeah, and they did send out. Did anyone else get reminders for the meeting?
Yeah,
their
actually,
email?
yeah.
Yeah, so I think they
I
send
got
out the
one
initial.
today and yesterday.
Yeah, they send out the initial one a week or two before, but then there should be a couple of reminders, and it sounds like something maybe went wrong with a couple email addresses this time.
It looked like we had Krukowski and Jose's emails mistyped, so we apologize for that.
Oh,
Oh,
okay.
thank you so much. I thought maybe I just couldn't see anymore. Great. Well, thank you so much for that. Any other new business, anyone? Any comments other than thank you, Darcy, for all that you guys are doing? If I ever receive a phone call from you, I hope it's just a hello, how are you? Sorry, being silly. Any other new business, anyone? Dale, I'm curious, what's going in next to Arby's on Ryan Road? Used to be Perkins.
That one, I haven't heard anything on that one.
Oh, because
Are
they're
they-
fixing
are
up
they
the
re-
parking lot.
Are they remodeling and stuff?
Well, they're fixing up the parking lot, so maybe
Okay.
they're starting with the outside first.
Yeah, I haven't heard anything on that one.
Okay. I'm excuse me for interrupting, but any other new business, anyone?
Nope.
All right, and again, thank you, Dr. D'Amico. Our next meeting is Thursday, January 7th. And if there are no further things to discuss, I'd entertain a motion to adjourn.
I'll second that motion.
Thank you, Rick, for firsting it. Any further discussion? No, all in favor?
Aye.
Aye.
Okay,
Aye.
opposed? Okay, Rick Berger, you have to call me. Okay, thank you so much, everybody. We're all done. Thank you so much. I appreciate it.
Have fun.
Everybody have a
Nice
safe
holidays,
ha-
everyone.
Safe holiday
Happy
season.
holidays, everyone. Darcy and Dale, stay safe.
Okay,
Keep
thank
up
you.
the good work. I know it can be tough, but we appreciate it.
Yeah.
Yeah,
Thank
thank you.
you.
All right, everybody.